When you call Colorado Crisis Services, there is a good chance that the person answering that call is at home. You shouldn't be able to tell a difference. It's a change that they made out of necessity. Our Anusha Roy takes a look at work from home during an emergency.
For more than 25 years,
I remember when we had, the little beepers.
Bev Marquez worked in crisis services the traditional way, together in a center, in person.
I started with a bias.
A bias about permanent work from home for such sensitive work. But then the pandemic hit. The need for mental health help skyrocketed, and it was so hard to find enough staff. So Rocky Mountain Crisis Services has gone remote.
70% of our workforce now, there are 193 of us that are working remote, and I won't be surprised if that feels a little uncomfortable.
It's why Bev, the CEO, is sharing how this works. Employees send in pictures of HIPAA-compliant workspaces. They're using noise-canceling headsets set up in office where others can't hear their conversations or see their computer screens, and have good internet. If they can't meet those requirements, they have the option to work in person.
It seems to be working well for our quality, for our retention.
They are expecting more people to call after the national 988 line was launched. Other states are also recruiting for their own teams here in Colorado. So crisis services needed to hire from across the state.
Didn't want to move into Denver, didn't need to be in Denver, couldn't afford to live in Denver.
911 is a very difficult job to do remote.
Denver's dispatch center became creative out of necessity. They are so short-staffed, some people are put on hold when they call 911, and not every position can be work from home.
This was an experiment, and we told them that from the beginning.
But they found a way to make it work for people answering the non-emergency line. That makes up more than half of all of their calls.
8 calls on a separate phone system. Document that information. It increases the chance that a 911 call taker will be ready and available when that next emergency call comes in. They won't already be on a non-emergency call. The second thing it does is it has helped to reduce burnout.
So Denver 911 is really trusting their remote workers to set up their offices in the appropriate way. They're, of course, monitoring things from their end as well. Of course, it's not alleviating all of the problems. Here in Denver, you can still find yourself on hold when calling 911, anywhere from 30 seconds to a couple of minutes. They said you need to stay on the line because if you hang up, you actually end at the back of the queue. So it's better to just stay on the line. And of course, Kyle, they are working on hiring more people. They're trying to double their capacity for training this fall because that part you can't do from home, and so they just need more people in the office.
And I'm sure, like in any industry, some people want to work from home, but this is pretty taxing work to be doing by yourself at home,
Yeah, I mean, that's one of the things I've been wondering about all day. And when I asked Bev, she said they actually surveyed their current staff, and a lot of them said, we don't want to come back to the office. But that means you have to really make sure you're taking care of your team because, like you said, it's such intense work. A lot of that is going to be on supervisors checking in. They're going to be watching if somebody calls out sick repeatedly, check in on them, things like that to make sure that they're taken care of.
Anusha Roy, thank you. If this story has you thinking that you might want to reach out for help for yourself or somebody in your life, know that Colorado Crisis Services and 988 are available at any hour of the day. Call 1-844-493-8255 or text the word TALK to 38255.